Uh, Anatomy of nose and paranasal sinuses. Uh, we will be discussing the anatomy under the following headings: external nose, internal nose, the blood supply, nerve supply, uh, lymphatic drainage. So, first about the external nose, it is a triangular pyramidal structure which is composed of bony and cartilaginous framework. The bony part is the upper one-third part, and the cartilaginous part is the lower two-third part. The few terminologies, that is root of the nose, it is the upper angle of nose where it is continuous with the forehead. Base of the nose, which is triangular, directed downwards. Tip of the nose, which is free angle of nose below. Dorsum of the nose, which is formed by the lower cartilaginous part which is connected to tip. The bridge of nose, the upper bony part of dorsum connected to the root. It is the junction between the two nasal bones, and glabella is a point between root of the nose and forehead. This is a picture showing the various parts of the external nose. The glabella, bridge of the nose, nostril, tip of the nose. This is the columella. Now the bony part, which is the upper one-third part, it is formed by the paired nasal bones, paired frontal process of maxilla, the nasal process of frontal bones, superiorly the nasal process of frontal bone. The nasal bones articulate superiorly with nasal process of frontal bone, inferiorly with the upper lateral cartilages, laterally with the frontal process of maxilla, and medially the nasal bone of the opposite side. Two terminologies, that is nasion and rhinion. Nasion is the upper point where they meet, and rhinion is the lower point where they meet. In this picture, this is the nasion. The cartilaginous part is formed by the paired upper lateral cartilages, paired lower lateral cartilages, which are also called as LR cartilages, sesamoid cartilage, which is also called as lesser LR cartilages, the septal cartilage. It is hyaline cartilage basically, and the bone and cartilages, they are connected to each other by periosteum and perichondrium on either side, which is continuous. The picture is showing the nasal bones, the upper lateral cartilage, the lower lateral cartilage or the LR cartilage, the septal cartilage, Now the upper lateral cartilages, they are triangular in shape. They form the dorsum of nose. Uh, the lower lateral cartilages, which are also called as the LR cartilages, they maintain the projection and shape of the tip of the nose. The parts of lower lateral cartilages or the LR cartilages are the medial crura, which is two in number, and they basically unite in the midline and form what is called as columella, and the lateral crura, which form the ala of the nose on either side, and the projection between the two that forms the tip of the nose. The sesamoid cartilages or the lesser alar cartilages, they are minor, two or more in number. They present between the upper and the lower nasal cartilages. Talking about the skin of the nose, the external nasal skin, it is continuous with the skin of the vestibule and columella. It is thin, freely mobile over the areas of nasal bone and upper lateral cartilages, while it is thick and adherent over the LR cartilages, and it contains sebaceous glands. There is a clinical condition which is called as rhinophyma, which arises because of hypertrophy of these sebaceous glands, which are located over the uh, LR cartilages. The muscles of the nose. It is the facial muscles which bring about movement of the nose. Procerus, that is one of the major muscle. The other muscles are nasalis, which has got transverse part and alar part, levator labii superioris, depressor septi, anterior and posterior dilator nares. These muscles, they arise from the fascia and get inserted into the skin, and they have got supply from the seventh cranial nerve, that is the facial nerve. This is a picture showing the muscles of the nose, the procerus, the transverse nasalis, dilator nares, levator labii superioris, ala nasalis, depressor septi, the internal nose. Basically, the interior of the nose is divided into right and left nasal cavities by the nasal septum. They communicate with the external environment through the anterior nares, and posteriorly, the nasal cavities, they communicate to the nasopharynx by the choana, and on either side through the sinuses uh, through their openings. That is called as ostium of the sinuses. The dimensions of each nasal cavities, it is regarded as 5 to 7 centimeters in length, about 5 centimeters in height, 1.5 centimeters transversely at the area of floor of the nose, and 1 to 2 mm at the area of roof of the nose. The parts of the nasal cavity are divided into vestibule, which is the skin-lined area of the nose, the anterior-inferior part of the nose, which is lined by skin. The nasal cavity proper, which is the area of the nose which is lined by the mucosa, that is the respiratory epithelium, uh, and the nasal cavity proper has got medial wall, lateral wall, roof, floor. The nasal vestibule. It is the anteroinferior part of the nasal cavity, which is lined by the skin, contains hair that is called as vibrissae, hair follicles, sweat glands, sebaceous glands. Lymen nasi is the superior margin of lower lateral cartilage which separates the vestibule from the nasal mucosa, and it forms the upper limit of the nasal vestibule. Then the nasal valve. These are the narrowest part of the nasal cavity, which is triangular in shape. This is the area of high resistance uh, with mild narrowing that often causes nasal obstruction. Uh, Medially, it is bounded by cartilaginous septum. Caudally, it is the floor. Laterally, it is the anterior end of inferior turbinate and lower border of upper lateral cartilage. The columella is between two nasal vestibules formed by the medial crura of the alar cartilage, and it forms the caudal end of the nasal septum. In this picture, the upper lateral cartilage, septum medially, the lateral wall, floor of the nasal cavity, and the nasal cavity proper that contains the inferior turbinate in the lateral wall. The nasal cavity proper. So it is bounded by floor, roof, medial wall, and lateral wall. The floor of the nasal cavity is made up of hard palate, palatine process of maxilla in the area of anterior 3/4, and horizontal process of palatine bones in the area of posterior 1/4. It is regarded as 5 centimeter in length and 1.25 centimeters in width. The roof. It is the highest part of the nasal cavity. The anterior sloping part is formed by the nasal bones. The posterior sloping part is formed by the body of sphenoid, and the middle horizontal part is formed by the cribriform plate of ethmoid. The olfactory area, it is bounded laterally by the superior turbinate, medially by the septum, and superiorly by the cribriform plate. Uh, Through this area, uh, the infection can pass through the cribriform plate to the anterior cranial fossa. The medial wall, or it is called as the nasal septum, it has got bony part and a cartilaginous framework, which is lined by the mucoperiosteum and mucoperichondrium. The septum is divided into three parts: columnar septum, membranous septum, and the septum proper. Columnar septum is covered by skin and formed by the medial crura of the alar cartilage. Membranous septum is in between the columnar septum and the septum proper, which is deficient of any bone or cartilage. It is simply having a double layer of skin. And the septum proper, which has got the cartilaginous part and bony part. The cartilaginous part is formed by the large septal cartilage or quadrangular cartilage with contributions from upper and lower lateral cartilages as well. This quadrangular cartilage or the septal cartilage, it provides support to the tip and dorsum of the nose. The bony part of the nasal septum, septum proper, is formed by the perpendicular plate of ethmoid, vomer, maxillary crest at the inferiormost part, and the palatine crest. Apart from these, small contributions are made from nasal spine of frontal bone, rostrum of sphenoid, and anterior nasal spine of maxilla. There is an organ called as Jacobson's organ, which is concerned with smell in lower animals. It is vestigial in human beings. So this is a picture showing the parts of the nasal septum proper. This is the columnar septum, which is formed by the medial crura of the alar cartilage. This is the membranous septum in between columnar septum and the septum proper, which is devoid of any bone or cartilage, simply bounded by two layers of skin. And this is the part of the septum proper, which is comprised of cartilaginous part formed by the septal cartilage and bony part, which is formed by the perpendicular plate of ethmoid, vomer, crest of the maxilla, inferiorly crest of palatine bone, and rostrum of sphenoid, nasal spine of frontal bone, and crest of nasal bone. Small contributions from these, and also anterior nasal spine of maxilla. The lateral wall, it is irregular and it is covered by the respiratory epithelium. It is formed by various bones, and this is basically the main area for drainage of the secretions from the sinuses. It is formed by the medial wall of maxilla, middle and superior concha, which is the part of ethmoid bone, inferior concha, medial pterygoid process of the sphenoid bone, nasal bones, perpendicular plate of palatine bones. It has got scroll-like or shelf-like ridges or bony horizontal elevations, which are called as turbinates, superior, middle, and inferior turbinate, and beneath and lateral to them are the depressions, which are called as meatai, the superior, middle, and inferior meatus. The superior turbinate is the smallest. It is a part of ethmoid bone. The area above it and its medial part is lined by the olfactory epithelium, and the opening or ostium of the sphenoid sinus lies just medial to it. Supreme turbinate is present in 60% of cases, unilateral or bilateral. It is present above the superior turbinate. Then middle turbinate, which is a part of ethmoid bone. It is formed by middle concha, has got basal lamina which joins the lamina papyracea, has got an ascending limb which joins to the cribriform plate, has got a bony lamella, that is the basal lamella or the ground lamella, which is through which it is attached to the lateral wall. One of the anatomical variants of middle turbinate is concha bullosa, which is pneumatized middle turbinate by the ethmoidal air cells seen on CT scan. Then paradoxically curved middle turbinate, which causes narrowing of the middle meatus. Then inferior turbinate, which is the largest, and it is a separate bone. It is composed of inferior concha, and the submucosa of this area contains rich cavernous venous plexus. Superior meatus, it is smallest, lies beneath the superior concha. It has got openings for the posterior ethmoidal air cells. Then sphenoethmoidal recess, which is a triangular area above the superior turbinate, where the sphenoidal sinus opens. The middle meatus lies below the middle concha, the middle turbinate. The major structures which forms the osteomeatal complex lies in the middle meatus, that is the frontal maxillary anterior ethmoidal sinuses. They have got the drainage into this area, middle meatus. Inferior meatus is largest and it presents along the whole length of the lateral wall. One important structure, that is nasolacrimal duct, it opens in the anterior part under genu of inferior turbinate, and the opening of the nasolacrimal duct is guarded by a wall that is called as Hasner's wall. This is a picture of the lateral wall of the nose, which is showing superior turbinate, middle turbinate, inferior turbinate. Beneath these are the superior meatus, middle meatus, and inferior meatus. This is the anteroinferior part of the nose, which is called as vestibule. The posterior end of the nose, that is called as choana. The lining of internal nose. The vestibule is lined by skin, that is stratified squamous epithelium. The upper 1/3 part of the lateral wall till the area of superior concha, roof, and the nasal septum, that is lined by the olfactory epithelium. And the lower 2/3 part of the nasal cavity is lined by the respiratory epithelium, that is ciliated cuboidal ciliated columnar epithelium. This epithelium lining is thickest over the concha and thin over the areas of meatus and floor of the nasal cavity. That is the pseudostratified ciliated columnar epithelium. The blood supply of nose. The arterial supply is through internal carotid artery, two main arteries, the internal carotid artery and the external carotid artery. External carotid artery through its branches, that is maxillary artery. The further branches, sphenopalatine and the greater palatine. Facial artery, the branch of it is superior labial. Internal carotid artery, which further divides into anterior and posterior ethmoidal artery, and further the branches of thalamic artery. Lateral wall, the main artery is the sphenopalatine artery, which supplies all the turbinates and the meatus. Roof and superior part is supplied by the anterior ethmoidal artery, and the ala nasi is supplied by the superior labial artery. The medial wall, that is the septum, has got supply from the anterior ethmoidal artery, sphenopalatine artery, that is the main artery of epistaxis, also called as the artery of epistaxis. The four arteries, they form a plexus or they form an anastomosis over the anteroinferior part of the nasal septum, which is also called as Little's area. The anastomosis is in between the anterior ethmoidal artery, sphenopalatine, greater palatine, and superior labial branch of the facial artery. This is the most frequent site for bleeding anterior epistaxis. So this is the blood supply of the nasal septum. Anterior ethmoidal artery, then sphenopalatine artery, greater palatine, and superior labial branch of the facial artery. These four, they form the anastomosis, forming a plexus which is called as Kieselbeck's plexus. And the blood supply of lateral wall of nose, that is through the internal carotid, its branches of thalamic, the anterior and posterior ethmoidal, and external carotid through its branches, that is maxillary, lesser palatine, greater palatine, and facial. The venous drainage of the anterior part is through the into the anterior facial vein and the ophthalmic vein. The middle part drains into the pterygoid venous plexus, and the posterior most part drains into the pharyngeal plexus of veins. Two important things: retrocolumella vein that lies just behind the columella, which is a common site of venous bleeding, and Woodruff's plexus, which again is present at the posterior end of the inferior turbinate, and it is the common site for venous bleeding and posterior nasal bleeding, posterior epistaxis. The Woodruff plexus, that is posterior, it is present at the posterior end of the middle turbinate. It is the most common site for posterior epistaxis. The nerve supply of nose is through the trigeminal nerve. The sensory supply is through the trigeminal nerve. The ophthalmic nerve, which supplies the anterior and superior part of the nasal cavity. Maxillary nerve, supplying the posterior two-third part of the nasal cavity. Infraorbital nerve, supplying the vestibule of the nose. The motor supply is through the facial nerve, and olfactory nerves, which carry the sensation of smell, which are 18 to 20 in number. The nerve supply of the different areas. The secretomotor supplies through the median nerve, that is the nerve of pterygoid canal, formed by the deep petrosal nerve and greater superficial petrosal nerve, that is the parasympathetic supply to the nasal glands and control the nasal secretions. And lastly, the lymphatic drainage of the nose. The anterior part and the external nose drains into the submental group of lymph nodes. The posterior part drains into the retropharyngeal lymph nodes and the upper deep cervical lymph nodes.